Do you think that China has dealt with this crisis the best, and what specific things do you think other countries should be learning from the way China dealt with it?
Well, I think, yes, I think that the data shows that it's absolutely quite clear. Firstly, China, as I say, if the first lockdown in Wuhan came on 23rd of January. The worst day for cases was then 3,887 on the 4th of February. That is, you had 13 rising days of cases, and then since then you've had 6 weeks of declining cases. So this speaks for itself. But what people don't understand is that the outbreak in Western Europe and in the United States is much, much worse than the one in China, because it's not very meaningful to make a comparison in absolute numbers when China's population is so much bigger than that of other countries. It's more than 4 times the case of the size of the United States population, 23 times the size of Italy's population. That means, therefore, for example, that when you have the same number of cases in Italy and in China, this actually means the situation is 23 times as bad in Italy in terms of its intensity. Or if you look at the cumulative cases in the US, which is 160,000 as of today, actually compared to China, that's 700,000. Now, the total number of cases in China is just slightly over 80,000. This means that the situation in the United States in terms of the population is 10 times as bad as the situation in China. And this is because they're not taking extremely rigorous measures. They're not making mask wearing compulsory. They're allowing people to go out. And if you do this, the number of cases will continue to rise. Then in order to allow people to stay at home, you have to put in place a tremendous infrastructure, because you've got to deliver food to them, you've got to deliver essential medical supplies, so it needs an all-out social mobilization. And the facts prove that China was correct. And I'm afraid to say, so far, throughout Western Europe and throughout the United States, the number of cases is rising very fast.
And do you think what you just said there, do you think that perhaps some countries haven't fully understood yet how to do this? Even the ones that have said, yes, we need to get people staying at home, we need to lock down. But, for example, in India, people are locked down, but they can't get access to food. They're saying that we're going to starve to death. Some countries perhaps don't even understand how to do this properly, even though they're trying?
Well, it's very difficult, and of course you have to have a huge apparatus of deliveries, etc. India is a country in which I've visited several times, and the situation there must be absolutely nightmarish. But the fundamental thing that you've got to understand is you've got to impose the strictest possible measures. All this, for example, just simply giving people advice and so on. I was on your program earlier, I was seeing, for example, the United States, they're saying this is not a lockdown, this is a travel advisory. Well, I'm sorry, those measures won't deal with it. You have to have a proper lockdown, otherwise you won't do. Gradually, each country will be forced to move towards the type of measures which China has got. I mean, I'm not saying this to criticise anybody, because the situation is much too serious to engage in sort of political or other type of attacking of people. What I want them to do is I want them to study China. Instead of the criticisms which is appearing in the Western press, they should be desperately in contact with China, asking them for the advice. China's also by far the biggest manufacturing country in the world. It can help enormously with supplies of medical equipment. So in every sense that they should be in contact and asking for every possible advice and every possible practical help from China. That's why I want to stress that really the situation in the West is much worse than the situation that was even at the worst time in China.
When we get to a point where things have dramatically improved, nobody knows, of course, when that will be. How do you think China is going to be perceived? Because, as you said, there's been a lot of criticism for the country because of a perceived lack of transparency at the start of the outbreak. But at the same time, they've been praised hugely from the likes of the World Health Organization.
Well, yes, there's no need to romanticise things. This was a virus which nobody had ever seen before, so therefore it was absolutely impossible that everything would be done right at the beginning, and it wasn't, and China doesn't claim it was. What they have done is, once they decided on the decisive measures, I say they were able to stop the rise in the number of cases after 13 days, and it then took a further 6 weeks to get it down to 0, but it showed that it could be stopped. I think the situation is so serious that all this nonsense which is appearing about China and criticism will be just cut through, because this is going to be the most global cataclysmic event since World War II. Many people, in fact, almost all people, don't want to die. And therefore they will have a situation in which they will have to learn the truth. So my view is that all the misrepresentations and nonsense which is coming out will fall away, and people will understand that China is the only country which has got the virus fully under control, and therefore that's the country which you have to study most.
You talked about the fact that some people called the Chinese approach draconian. Just very quickly, if you could compare it with the UK, who were looking to very gently develop this sort of herd immunity, do you think that they could still prove to be right or not?
No, not a chance. The government has already reversed its policy here, right? The stuff on draconian is nonsense. I mean, somebody said to me on an exchange, well, what about China's human rights record? I said, China's human rights record in this is keeping people alive. And therefore, this is much, much too serious. The government is going to have to take what would be called draconian measures. Otherwise, they won't succeed in getting on top of it. That's why it's continuing to spread extremely rapidly in Western Europe and the United States. They will be forced to save people's lives, and people will demand it. That adequate measures are taken. Otherwise, the virus will not stop spreading. There is no vaccine. There is no cure.